let's talk about a top pregnancy website that is not at all what it seems and why you must avoid it. Hey everyone, I'm Dr. Jennifer Lincoln, board-certified OBGYN, author, educator, and today maybe investigative reporter, I don't know. Actually, I'm not. Somebody else did the reporting. I'm just telling you about it. This YouTube channel is the health class you didn't get in high school. Go ahead and like, subscribe, turn on the bell so you never miss an upload. I'm gonna jump right into it. The American Pregnancy Association is bad news, which you might think is weird because when you Google anything pregnancy related, this website, I'm going to call it the APA. The APA website often is in the first 1 or 2 top Google hits. And they market themselves as a neutral pregnancy, postpartum, breastfeeding, parenting website that has medical and evidence-based information, and it could not be farther from the truth. What most people don't know is that this website and this organization has a hidden anti-abortion agenda. An investigation featured here in Reveal, I'll have the link to the website below, but it was done by the Center for Investigative Reporting. They found out that this organization has deep ties to the anti-abortion movement, and it starts with their founder. So it's this guy here, Brad Imler, and he does have a doctorate in education, not in medicine. And so when you looked at his LinkedIn, right under his name, he's advancing the cause of life. Okay. And you see it right there in his about. I'm passionately Christian and pro-life, which is fine. If that's what he believes, totally fine. But then he launches right into about how many abortions they are and how there's all these orphans and that we have to do everything possible. Like, you can just tell that he is somebody who does not agree with abortion personally. Again, fine. But he founded this organization to coerce people out of abortions, which is not what you see when you Google the APA and this website pops up. And so in his own words, he has described the organization as a tool for abortion-minded women, which is the weirdest way to describe somebody. Their original content was overtly anti-choice, but then they softened it so it would look more neutral, and people would stumble upon this website and think that it was just evidence-based pregnancy information. So here are some top facts about the APA. Number 1, it is not written or run by medical staff like nurses or doctors, or in fact, any licensed medical professionals. Number 2, a lot of their content is either outdated or complete misinformation, especially when it comes to birth control and abortion. So let's just walk through this site together. So when you land on it, you see, oh, pregnancy questions, we're here for you. It looks warm and inviting. It looks like any other pregnancy association, reliable info, just like maybe the American College of OBGYN, right? But let's click on the Unplanned Pregnancy tab and scroll down to abortion. And this is where you start to get some ideas that this is interesting. But yet it's confusing, right? Because you see a woman's right to information. So you think, oh, wow, they're going to discuss all things. Then it goes into birth control, pregnancy options. And then you see they have a tab on abortion pill reversal, which is not a thing. And I have a whole video describing that and talking about how this is not something that is evidence-based. When you see that, that should always put your spidey senses up, that this is not a reliable evidence-based neutral website. I also want to highlight that their helpline is not something staffed by medical experts. It actually connects you to a call center run by Heartbeat International, a major anti-abortion organization. And the next thing that's super weird, when you go down to their Chat Now button, when you click on it, look what they want. They want your name, they want your email, they want your zip code. That's sketchy. They want your age, your ethnicity, your insurance type. Like, that's weird to be asking those questions of somebody who might just have a random question. Like, that feels like, what are they doing with this data? Are they tracking it? It doesn't feel good. Okay, so in other words, when somebody is on this website or engaging in the chat or the call center, they think they're getting in touch with medical experts, and it couldn't be farther from the truth. So let me just show you one more example of their misinformation. So let's go on the birth control tab. Their information is incredibly biased. They are talking about how birth control causes abortions. It doesn't. More information up there. And they're using this rhetoric that being on birth control means you're going to want to have sex more. Like, this is very coercive counseling, which is really confusing if somebody who just has birth control questions lands on this website and thinks that they're getting legit information. And when information is biased or incomplete, it's not just annoying, it can put people's lives at risk. So why does this matter? When people are Googling pregnancy information and the APA website comes up, People go here thinking they're getting evidence-based, neutral information that's not coercive, and it's absolutely not the case. This can delay care for anything, but especially for somebody who might want an abortion. And when we live in a world where so many states have either banned or restricted abortion, and people have to travel or have to work harder to get the abortion they need, to have this website sow fear or doubt, or even act like they're going to engage with them on the phone or in a chat and get information when they're just being delayed and things are getting even harder, further along, more expensive, like that's not okay. So no, Brad, it's not okay that just because you don't like abortion, you've made a whole website that's now tricking and fooling a bunch of people. And this isn't about being pro anything. It's just about being medically accurate. And here's my big confession about the American Pregnancy Association website. I used to think it was a good source of information. In fact, about 15 years ago when I was writing medical articles for a website, I frequently referenced this because when I was looking stuff up, this came up and it just seemed, I thought, oh my goodness, this is a legitimate source. It's not. But if me, an OBGYN, a physician couldn't tell that, how can you expect people with no medical background to? So if you were looking for accurate reproductive health information, the APA is not it. I highly recommend, and I will put these resources in the show notes, I recommend the American College of OBGYN. Bedsider.org is fantastic for birth control information. Planned Parenthood, yes, it's great information for abortion, but also for other things like birth control and sexually transmitted infections, and a few others that I will drop in the show notes below. So the bottom line is that the American Pregnancy Association is not a reliable source of information. And what's really concerning is major hospitals, medical schools, other organizations list them on their reference list or think that they're legit and send their patients there. But what you're sending people to is a boatload of misinformation. And it's all thanks to Brad and the people who work for him, who instead of letting people just have a true choice, they're just trying to talk them out of the healthcare they may need. So take care and trust your critical thinking as much as you trust your search engine. Maybe even a little bit more. Till next week, stay safe, my friends.